Hi, welcome to week 4 of your MSc Clinical Gait Analysis. I am Dr. Richard Jones. We did not meet face to face in the induction week, so hopefully now you can put a face to a name. I hope you're enjoying the course thus far and are engaged with some of the ways of enhancing your knowledge through the different approaches that we're using. In this week, I will be covering some of the aspects of clinical video in a gait assessment, but also in the wider environment, which would reflect on your own clinical practice. This week we'll be looking at why, how and when to collect clinical video and some of the important aspects we must take into consideration for good quality measurement. If you think about doing any analysis of human movement, the level of equipment can vary both in cost and complexity. The aim of this week is to get a good grasp of the technical requirements of collecting good video and also examining other ways of collecting this clinical video. If you are not in a laboratory environment, clinical video is one of the simplest assessments for clinical gait analysis and involves small pieces of equipment and in some occasions software to be able to review and interpret the information. Two of the principal learning tasks that you'll be doing this week involve collecting clinical video and uploading these to the CMaster YouTube channel, and also completing a service protocol for the collection of clinical video. This is the first service protocol that you will undertake on the master's course, and there are some guidelines and also a template that we've developed which you can use unless you have your own templates. So in the future the aim is that you will have service protocols for all aspects of the measurements that we are covering in the Masters in Clinical Gait Analysis. You will also note that there is a task involving moving your camera slightly to examine one of the errors associated with clinical video. I would like you to calculate a knee angle using the software in this week's material and understand the importance of setting your cameras up correctly. Finally, I would also like you to use a different type of media, such as a webcam or an iPhone, for example, to record a video and to evaluate this and think what type of recording may be useful in times when the lab is not available, and also see if the quality is as good as what you collected in your laboratory environment. Finally, there are some indicative reading material with some extra information on observational gait analysis and the tools that are used. These are from the Rancho Los Amigos lab, also the Salford gait tool, the Edinburgh gait assessment scale, and also the Rivermead scale. Hopefully they will broaden your knowledge further in this area, but they're really for extra reading for you. I hope you enjoy this week's work, and I'll see you in the virtual classroom on Wednesday. Bye.